We know that women are an important part of the ESMO community, and in fact, they represent currently more than 50% of ESMO members, and particularly we have many women under 40. We don't know if pandemic is having a different impact in men and women in the oncology field, but we are worried about the potential future impact if this is true. For instance, if women oncologists are currently dedicating more time to children care, elder care, or even housekeeping duties in comparison to the time men oncologists are dedicating to these activities, it could mean that men can take advantage of the confinement for being prepared better for the future, meaning that they are dedicating more time to science activities such as, for instance, preparing paper, a grant, or whatever. So if this is true in the future, in the near future, maybe we are going to see an increased gender gap, having more men in key positions and having more men increasing their career. ESMO Women for Oncology Committee has decided to launch a survey focused on gender impact on COVID era. The idea of this survey is to identify if there are inequality gender issues as the best way to promote a solution for that. We will ask men and women to participate in the survey because it's really key for us to identify the different views in order to be sure what are the issues. There are one part focused on the possibility to be involved in COVID committees, because we don't know if the percentage of women invited to join COVID committees at different levels is similar to the percentage of men or not. There is another important part of the survey that is focused on the time dedicated during the pandemic and just after finishing the confinement to different activities in comparison to our previous life. We spent a lot of time and we dedicated a lot of effort in previous year to build on the idea of gender equity, and would be really sad and really worried if only 2 months of different situation, 2 months of confinement, 2 months of hard time for every one of us can be able to change that in a bad way. And the influence of previous act disappeared so easily. So I would like to say that this is not true, but we don't know. The result of the survey will help Women for Oncology Committee really to identify the best strategies to minimize the gender inequalities.